trying to be careful in transmitting concepts to English.
That's certainly understandable. Thank you, Mohammad.
I prefer to talk less and give you opportunity to talk more and more.
Okay, sounds good. So tell me again, tell me who you are with.
Okay. My name is Mohammad Baazm, a researcher of the Secretariat of the Commission for Quranic Studies in Health System affiliated by the Ministry of Health in Iran.
Very good. Thank you.
Thank you so much. I have a lot of questions, but I try not to offend you. At first, about a year ago, I asked you to record a video about new studies and researches in religion and health. Your valuable video made Minister of Health in Iran welcome to this study.
Really?
And yes, and so let us to work more and more.
Good.
We changed our name of our institute to Secretariat of Commission for Quranic Studies in Health Systems. Actually, we are going to study about the relation between religion and health. And your valuable book, very useful for us. And we are going to translate it into Persian.
Excellent.
And will be published very soon.
Very good. I'm honored that you would do that. Very honored that you would translate any of our books into Persian.
Thank you so much. And now we are trying to support various research centers and institutes in Iran that work in this field, the field of religion and health. I ask you to inform us about the latest studies and researches in the religion and health in the world. So my question divided in two groups, general and professional. Please tell us at first, when did you realize that the religion can have an effect on health?
When did I first realize that religion could have an effect on a person's health? Well, I was trained as a nurse, as a registered nurse early in my career, and also then as a family physician. And that is when I realized that religion was very important to patients. As I would be seeing patients in the hospital, I would ask them, how are you coping with your illness? How are you dealing with these health problems? And many of these were older adults with serious health problems. And they would talk about their religious faith. They would talk about prayer and how important it was for them in coping with their illness. So I thought, you know, this is very important to many patients, but there is no training on this in any of the health professionals. I didn't receive any training as a nurse, nor as a family physician. And, you know, since I've been trained in geriatric medicine and geriatric psychiatry, really nothing has been part of my education and training in the area of religion and health. And yet it seemed to make such a difference to people. So that's why I decided that it would be a good idea to document this, to document, you know, the use of religion in coping, and then to examine the relationship with health to see whether or not patients truly were doing better if they were more religious.
Do you think religious commandment or instruction can affect human health or should be scientifically evaluated? Some of the scientists in Iran do not believe the effect of religion on health. What's your idea?
Well, your observation that many of the scientists in Iran are skeptical about this relationship between religion and health is also very true here in the United States and pretty much throughout the Western world, among scientists, that is. But among people, it's a whole different story. For people who are in the community who are struggling with their lives and trying to cope with stress and loss and change and difficulty, you know, managing day to day, religion is very important to their health. And that is what the research has shown. So there are literally now thousands of quantitative studies showing this connection between greater religious involvement and a person's mental health, physical health, social health, and behavioral health. So there is overwhelming evidence of this, and it's becoming difficult for the scientists in the United States to question this. It's becoming more and more difficult. This is particularly true since major research groups, other than here at Duke University, have been studying this relationship, including the School of Public Health at Harvard University. So Harvard University, Johns Hopkins University, some of the very, very best scientists, you know, in the United States and possibly in the world are now studying this relationship because it has such an impact on public health. See, the health of the public is very important now because we want to keep our populations healthy so that it doesn't cost a lot of money to be able to care for their health problems. This is going to bankrupt. It's going to use up all of the country's money trying to care for the health of older adults with chronic illness, due in part to their poor lifestyles. They're smoking, they're drinking alcohol, they're using drugs, they're not exercising. You know, all of these health behaviors are lower among those who are more religious. So there is good reason to expect that religion should be related to better health, better social health, and better mental health, because people cope better with loss and stress. They experience less depression, less anxiety. They just do less suicide, much lower rates of suicide among those who are more religion, because religion gives meaning and purpose to life. Meaning and purpose gives people hope and gives them an optimistic view of the world, which is very important for their health and their functioning. So I think the evidence is just growing overwhelming to the point that scientists cannot just ignore this anymore. They cannot, that's what they're doing. They're just ignoring it. But I think we're coming to an end of that. I think our countries need to be able to have the evidence that people, if they retain their religious faith, they will be healthier, they will be happier, they will be more socially connected, they will have stronger family lives, all of these factors affecting their health and well-being.
Excellent. Doctor, Does the government support religion and health studies in your country or not?
The government does not support religion and health studies very much, not at least now. There has been some support provided, but because of the separation of church and state, religion and the state and the government, which is so important in the United States, they try to keep things separate. The government has been reluctant to fund the research, but we are trying to advocate for more research funding in this area, because unless you have the money to do good research, you can't do good research. To do good studies, well done, well designed studies, it takes a whole team of investigators, and that takes money. So right now, much of the research is being done for free. I mean, people are just doing simple studies that they can afford to do. But if we had more money to support the research, then large studies could be done, and well-designed studies. And if the study improves in design and quality, we think the findings will even become stronger. But we don't know that, because we don't have enough resources to be able to really design these studies very, very well.
As I know, in some of the university, the religion and health became a discipline. Some of the scientists and actually the Minister of Health in Iran asked me how we can make religion and health studies as a discipline in University of Iran. What is your idea about this point?
I think that's an excellent idea. I think that investing money in studies of religion and health will pay off in the long run. Because one reason is because countries all over the world, with the growth of science and technology, have started to ignore and push out religion. And because of that, we think that with the lowering of religion, the secularization, people are becoming more secular, countries more secular, that's going to have consequences in terms of the health of the population. People are going to have more drug and alcohol abuse. They're going to be more depressed. They're not going to live healthy lifestyles. And all of that is going to cost the government money, lots of money. And so we think that investing research on religion and health, and in particular, I think in Iran, which has very strong religious beliefs that are essential for the people of the country. And they are, if anything, even more than in the United States, they are related, I think, to health in a stronger way. So as people become less religious, all of those benefits of religious faith are going to go away. And that's going to leave people on their own to struggle with all of the powerful human drives that are not good for us. I believe that God loves us. Because he loves us, he wants us to be as healthy as possible so that we can serve him, so we can serve God. If we're sick and unhealthy, we cannot serve God. We cannot serve God, our families, our communities. And so I believe that God wants us to be healthy. But in order to be healthy, there has to be a strong, devout belief and submission to God, because God loves us. If we submit to him, then our health will naturally be better.
Yes. One of the problems of religion and health studies in Iran is the lack of attention to methodology. We have many mistakes in methodology of religion and health. So we are going to translate your valuable book, Spirituality and Health, research. It's about the methodology, but I am going to ask you, what is your idea? What is your advice to our researchers? How their research can be methodological?
That's a very good question and very important for scientists. How can you do the very best research in this area and design the best studies? The book that you just mentioned, Spirituality and Health Research, Method, Statistics, it's got a long subtitle there. That is a summary of our 5-day research workshop that we have here at Duke University every summer. We've done that for 17, 18 years now. And we have had some people from Iran come to the workshop. They have had to go through Canada in order to get into the United States, to be able to do that. But we would hopefully in the future, our countries will work out some of the differences that they have so that we can bring people from Iran here to the United States to attend our workshop. But until then, the book was very carefully written and reflects most of what is taught in the workshop. So I would, we can email back and forth with regard to the translation, because there is a Templeton Foundation holds the copyright, so we have to get their approval. But I'm sure they would be delighted to give the approval. We just have to do it formally.
When we say religion, we mean every religion or just any Abrahamic religion or any religion in the world? What is your idea?
It's an excellent question. Does it matter which religion with regard to the health benefits? Most of what we know is about the Abrahamic religions, the monotheistic religions, Christianity, Islam, Judaism, these religions that believe in one God, one single, undivided God. And that is what we know the most about. And we can pretty much, that's what the research applies to, because the populations that believe in one God are the populations that have largely been studied. Now, the Eastern religions, we know some about the Eastern religions, and to some extent, devout practice within the Buddhist belief system and within the Hindu belief system. The Hindus actually believe in one over supreme God, although they have different beliefs about the other gods, but there's only one supreme God in Hinduism. And even in Buddhism, if you go to some of the Buddhist countries, they treat Buddha as God. So basically, they're just calling God Buddha when they're worshiping and praying, just like we pray to God and Allah, So in the end, many people are really believing and praying to and in one God. And so that seems to be essential, particularly with regard to devotion, being devoted, living one's life in a way that is surrendered to God, following God's words that he has written in the Quran, in the Bible, following those words and applying them in our lives is what seems to be so essential to our health. Now, if somebody just says, well, I believe, but they don't behave any differently, they don't treat people any differently, then that religion is not going to affect their health, whether they're Muslim, Jewish, Christian, Buddhist, or Hindu. It will not affect their health. It has to be strong enough so that it influences people's daily decisions in life. That's critical.
Okay. We talk about Abrahamic religion. So my next question is, what is your experience about Islamic religion and Islamic studies and health? What is your experience? What is your idea about Islam and health studies?
I think Islam and health studies are critically important. Um, in about 30 or 40 years, there will be as many Muslims in the world as there will be Christians. And after about 30 or 40 years, there will be more Muslims in the world than Christians. So the relationship between Islam and health is extremely important. Now, I have actually written papers with nearly 50 peer-reviewed academic papers with Iranian investigators. So I have a track record for the last 10 years working with Iranian investigators. It's been a wonderful privilege and an honor to do so. Also, I've been involved in writing on Islam and mental health. I have a book called Islam and Mental Health, Research and Clinical Applications. That might be another one that you might consider translating into Persian. And I actually own the copyright, so I could just say, go ahead and do it. And I'm the final authority on that particular book. But I've done I've been working with the Saudi Arabian people to conduct research in that part of area. And I go there every 10 years, not every 10 years, every year for the past 10 years, designing studies on religion, Islam, and mental health for research in that country. And have published many papers and have developed measures of Islamic mental health that of devotion in Islam that can be used in studies looking at this relationship between religion and health. I believe that some of these measures have been validated in Iran as well. So I think given the devoutness of the Muslim religion, of the Islamic religion, given that the people in Islam are so devout to their faith, and that's the key. The key is how devout you are to your religious faith. I think this is where even stronger relationships with health could be found. So I would say, yes, absolutely. And anything I can do to help, foster that, I'd love to.
Doctor, my question will be professional. Another problem in religion and health studies in Iran is about the concept of spirituality and spiritual health. The scientists in Iran has a different meaning and different concept about spiritual health. And they have the various concepts about spirituality. So their idea and their research cannot be useful for us. What is your idea or what is your key about the religion, the spirituality and the concept of the spiritual health for these studies?
Well, here in the United States, spirituality has become very diluted. There's been an attempt actually to get God out of spirituality here in the United States, so that it has become more like meaning and purpose. And so it's a very broadly defined. So the way the researchers here have been using spirituality, it doesn't mean anything anymore. It's so broad. Anyone can be spiritual based on the definition that currently is being used in the United States. Now, in studying the research coming out of Iran, I've noticed that when Iranians talk about spirituality, they're really talking about religion, which is the key. They call it spirituality, which is fine. You can call it whatever you want. It doesn't matter what you call it. Spirituality is a common, popular word descriptor, but it's what you measure that counts. It's what exactly you measure. And what you need to be measuring is religion. Religion is what you need to be, religious belief, religious devotion, religious practice. All of that's what's the key. Call it spirituality, and that's okay, but don't remove the religion like what's happening in the United States here. We're removing the religion from spirituality because the scientists don't like religion. Just like in your country, they don't like religion, so they do the spirituality, but they take the religion out of it, and then it becomes nothing but mental health. It's simply another term for meaning, purpose, hope, but that doesn't work, because the source of meaning, purpose, and hope, it comes from religion. So you have to measure religious beliefs and practices, because that's the source of where many people, not all people, but many people receive their sense of meaning and purpose in life, their sense of hope in the future and in the afterlife, and in their optimistic view of what's happening in the world. So you have to be measuring the source. That's critical. It's just like, let me give you an analogy. It's like if somebody has pneumonia, if they have a bacterial pneumonia that's in their lungs and that could kill them, and if the doctor, and they have a fever, the fever indicates that there's something wrong. And if the person only takes, only medicine to lower the fever, then the bacterial pneumonia will kill them, because you have to find the source of the pneumonia, not just the symptoms that result from the pneumonia, the fever, that's why you have to give people antibiotics to kill the bacteria in order for the pneumonia to resolve. The same is with regard to religion and spirituality. Religion is the cause, is the bacteria. And so, in illustrating this, it's so you have to measure that and then focus your interventions on that, on the bacteria, on the religion, in order to affect the mental health, the purpose in life, the meaning, the hope, all of this. You want to be sure to get the source and do interventions at the source of all of the mental, social, behavioral, and physical health benefits.
As you know, some of scientists, religion man in Iran believe that every commandment or every instruction that is in the Quran or in Hadith, our traditional religion, is useful for health. And it's not, it is not necessary to evaluate this commandment or instruction, because this is from Allah, from God, and we have not permission to evaluate this instruction and commandment. There are a lot of ambiguous concepts about spirituality and spiritual health, and I think we can solve the problem now, maybe in the future.
Yes, the concepts, the teachings in the Quran, in the Hadith, in the Bible, those are God's words. Those are God's words. And so we don't question those words. The problem is that we do not live by those words. Because again, the purpose of those words is our overall health and flourishing, because God loves us, and therefore he has given us instructions on how to live a full, happy, meaningful life in his words that he has sent to the Prophet Muhammad and to the people in the Bible, etc. You know, these are God's instructions on how to live a healthy, full, and happy life. So it's a matter of our belief and our faith that we can measure that. We can measure a person's beliefs, practices, and faith. We can measure that. You know, we don't have to be real specific, you know, but we can measure, you know, how frequently people practice their religious faith, how much time they spend on it, how much it is central to their life and their decision making. That's what we can measure. And then we can look and see whether or not that's related to health. Again, as scientists, we have to be able to design studies in a way that is unbiased and simply document the relationships. So if we have a measure of the religious belief and practice, the level of devotion, then we can look at the health outcomes. We can look at mental health, social health, family health, physical health, health behaviors, and that's the role that scientists have. We don't have any role in trying to prove, you know, that the scriptures are true or not. that is not the role of the science. The science is to look at, if people devoutly believe and practice in their religion, is that good for their health? And the answer is yes.
Are American hospitals currently using spiritual health as a cure for illness?
There is growing emphasis in American hospitals and in clinics, in outpatient clinics, to take a spiritual history. Take a spiritual history. So that's something that is becoming less controversial, that doctors should be open and nurses should be open to talking with patients about their religious and spiritual beliefs, and doing this in a supportive manner, in a way that encourages and supports those religious beliefs. So the taking of a spiritual history is becoming less controversial. That's actually becoming, here in the United States, part of what is good medicine and good nursing care, is to also address the person's religious and spiritual beliefs. So now, in terms of actually using it as an intervention, usually the doctors and nurses don't have enough time to do that, and they're not trained to do it. So we have what's called chaplains. We have chaplains here, which are clergy who have been trained in the hospital to address, you know, the kinds of religious and spiritual issues and needs that come up. And so we refer them then to the chaplain, who then addresses those needs. Now, in psychiatry, it's become a little different. In psychiatry and psychology, we now have religiously integrated psychotherapies for the treatment of depression and anxiety and other emotional disorders. So we've developed religious interventions that can be used by counselors, psychologists, and psychiatrists. And those religious interventions include Islamic interventions. So we have actually, the one intervention that we tested in a clinical trial was designed by an Iranian scientist, designed a Shia intervention for the treatment of major depression in people with chronic medical illness. So we have that. We have all different religions, and if you go to our website, you can download the manuals because these are structured psychiatric interventions. And we have manuals for the therapist, for the counselor, and manuals for the patient that they complete and they follow. So that's all available free on our website. Now, we also have religious interventions for what's called moral injury. Moral injury. Now, moral injury is often the result of people undergoing severe trauma. And when they experienced this severe trauma, it started out among soldiers and veterans, people, in the war, the military members who would end up, feeling very guilty and shameful and condemning themselves for the actions that they did in war. And so we have an intervention, including Muslim interventions, for the treatment of moral injury among those experiencing severe trauma. So I'm happy to send those to you too. If you're interested, I'm happy to do that. Just send me an email and I'll send you the manuals that we've developed. So yes, it's beginning to be integrated.
Doctor, how do you evaluate religion and health study in the war? They are strong or weak? What's your idea?
Say that one more time.
How do you evaluate the religion and health studies in the war? They are weak or strong?
In the war?
Yes.
War, W-A-R, war, right?
Yes.
Yeah, those studies they're focusing on the post-traumatic stress disorder. So there are some studies looking at, now I actually have a book that was recently published on religion and recovery from post-traumatic stress disorder that was really focused for the military members, those actively in the military and those who have been in the military in the past, the veterans. So those studies are now starting to focus on moral injury. See, those studies, because that's what religion can really help in. It can help people deal with the moral injury that the people in war are suffering from, seeing their compatriots be killed and die, and that's a horrific experience for many people. It leaves an injury, a moral injury in them. And so that's why we are now focusing on the development of interventions, measures of moral injury among veterans and active duty military, and then treatments, specifically religious, spiritual treatments for that moral injury that are based upon the core teachings of their religion. In the Quran, for example, our Muslim intervention are all totally based on the teachings in the Quran and the Hadith. That's how we address those, because religions have addressed these issues for thousands of years. They've addressed issues related to war and military. In Islam, the Prophet Muhammad was involved in many wars to spread the teachings of Islam, many wars. And so they had to deal with the consequences of the war. And so God revealed that through the Prophet Muhammad in the Quran, describing what to do in these situations. So that is why we think that, the interventions should be focused on this moral injury based on the core religious scriptures.
As a final word, if you have any advice or suggestion for our researchers in the study of religion and health, let them know.
Okay, it's very important to, particularly for Iran, to focus on two types of studies. The first type of study is what is called a longitudinal study, a prospective study where you assess somebody at baseline and then follow them over time to see whether or not the religious devoutness, the religious involvement predicts better health over time. People often have to be followed for 10 or 15 or 20 years before their health changes enough so that you can show that the religiosity influences the health over time. So those kinds of studies are very important because they provide evidence that the religion actually causes changes in health, can actually predict improvements in health or slower declines in health. So the prospective studies are very, very important. The other type of study is the randomized controlled trial. The randomized controlled trial is what most healthcare professionals understand. And so it's important to be doing those randomized controlled trials with a large enough sample so that you can detect differences between the intervention and the control group. Now, in terms of the control group, it's very important that, in the best of studies, the control group gets some kind of intervention that is similar to the religious intervention, but it doesn't include religion in it. Those are the very, very best studies, but they're hard to show a difference because the social interaction between the person, the therapist, and the patient has a benefit. So therefore, you have to have a large enough sample size so that you can detect the difference between the intervention and the control group in those instances. But when you're just starting out, it's fine to simply compare the religious intervention with no intervention or usual care. That's okay starting out. But ultimately, what you want to do is you want to be able to test the religious intervention against some other intervention, some secular intervention that is already accepted as being helpful. Then you can show the additional benefit that addressing the religious aspects can have on the outcome.
Thank you so much for your guidance and your advices. It was a real honor for me talking with you, and I know you are very busy, and thank you so much again.
Thank you, Mohammed. I appreciate your talking with me. Bye-bye.
Thank you so much. Bye-bye.
Bye-bye.